We continue to learn more by the mature data from the Momelotinib studies, as well as we will soon learn more as the Momentum study, which is fully accrued, continues to evolve along its path. We have recognized that momelotinib has an ability to improve anemia and make individuals transfusion independent. And that's likely correlated with the inhibition of ACVR1 and a decrease in hepcidin. And this goes along with the benefits in terms of splenomegaly and symptoms. Now, we'd previously seen these benefits in terms of anemia that we think will really make it a very useful agent in myelofibrosis, and currently further validation through that Momentum study. What I presented this year at the summer meetings was that we were able to correlate that achievement of transfusion independence by the use of momelotinib was associated with an improvement in survival. That was very intriguing and exciting. It was the first time that an improvement in anemia had been correlated with such a meaningful endpoint such as improvement in survival. Why do they live longer? I think at this point, it's still circumstantial evidence, but we could certainly speculate improved oxygen carrying capacity, less debilitation, but also it may correlate that the decrease in hepcidin and inflammation that corresponds with improvement in anemia perhaps has other benefits in terms of the bone marrow microenvironment, marrow function, decrease in the likelihood of the acquisition of additional somatic mutations or other risk of the disease becoming life-threatening. So it's exciting to see that as we have further development of JAK inhibitors, pacritinib, fedratinib, and our longstanding data on ruxolitinib, there is granularity between these agents, slight differences in terms of some of their correlative mechanisms of action, and some meaningful expansion of the endpoints that we're looking at that are meaningful both for treating physicians and most certainly for patients.